So now we move on to Stemi Management. So once we've done his ABCs, we've done the ECG, and we've got the IV access, the next thing we need to do is we need to give him oxygen. About 2 to 4 liters per minute, and you aim for an SpO2 of about 96 to 98%. After that, you take a brief history, and by brief I mean it's gonna have to be very short because you don't have time to be asking all the normal questions. All you want to know is his past history of cardiovascular disease, his risk factors. So what I was talking about earlier, he's obese, he's got hypertension, he's got high cholesterol, he's got diabetes mellitus, all of those. And then after that, you need to move on to giving his medication, and you start off with the antiplatelet drugs. And these are very important. The first one you give is aspirin, 300 milligrams per oral, and then after the start dose you move it on to 75 milligrams per day. You also give clopidogrel, 300 milligrams per oral, and once again after the start dose you move it on to 75 milligrams per day. You also give anti-ischemic drugs, which are glyceryl trinitrate, 2 puffs, or you can give 1 tablet sublingual. You can also give a beta blocker such as atenolol, 5 milligrams IV. But remember, these are contraindicated in asthma and left-sided heart failure. This is very important. Then you move on to the low molecular weight heparin. You give enoxaparin intravenously. Now, after all of this, if this doesn't work to get rid of the clot, and the patient is still deteriorating and is not making any difference, you move on to interventions. So you take the patient to either the cath lab or the theater, and in the cath lab you can do a PCI, which is a percutaneous coronary intervention. Basically what that is they insert a stent up through either the radial artery or through the femoral artery. They bring it up towards the heart, find the blockage in the coronary arteries with the help of an angiography, and they basically open up the stent, which pushes the blockage towards the walls of the artery. Or if you can't do this, you can also do a CABG, CABG, which is a coronary artery bypass graft. This is done in a theater, and this is done by a cardiothoracic surgeon. Basically what they do here is they bypass the blood supply of the coronary artery with another artery. Usually they take the left internal mammary artery. Usually this isn't done as much anymore, but in severe cases this is what they do. This is an open heart surgery, but this is the main one. This is the best one. You can also do things like balloon angioplasty, where they insert a balloon into the coronary artery and they open it up and it pushes the blockage to the walls of the artery. It's similar to PCI. But yeah, guys, that's how you handle a STEMI, the signs and symptoms, the etiologies, and whatnot. So if you enjoyed this video, let us know, give us some good feedback, and we'll catch you on the next one. Thank you.